of course, who made who? Well, that's the big question on everybody's mind. Dr. Eugene Cherny is here from Heartland Plastic Surgery, as that's the big question when people were looking at a Swedish model, Dr. Cherny, who did something that was really, to a lot of people, bizarre.
Well, that's one thing about talking about plastic surgery, because there's always somebody doing something crazy out there. And it's, well, it's just an interesting trend. I've seen this actually in my practice, that smaller and smaller waists are becoming more and more popular. And
look at this gal.
Jeez. Yeah, this is actually overdone. We actually.
You rethink?
I know.
Wow.
Well, so a small waist in history has always been considered a thing of beauty. I mean, that's why.
Like here, look at this here.
That's why corsets were constructed way back.
Absolutely, absolutely. You remember they talked about corsets on Gone with the Wind. It was very popular, and this is very much the 1950s look, is to have a small waist with wider hips and a wider chest. And now people are trying to create that, and this patient actually went to the extreme of having her ribs removed.
I was going to say, there's a point of extreme, because unfortunately the Kardashians are kind of bringing this back as well, and it's not
here she is.
It's not necessarily a it's not necessarily a healthy thing to do. I mean, what are you doing? Let's back up to corset here for a second. What are you doing to your insides if you're strapping something that tight around your body?
Well, what you're doing is you're altering your internal anatomy. You're actually gradually reshaping your, say, your liver and your spleen, and and she has huge breast implants, if you didn't notice.
No.
If you couldn't tell.
Waist is 16?
That's just not normal.
Waist 16, so it makes her smaller than Betty Brosmer. She was the first supermodel in the 1950s who had and she had this very tiny waist that she was known for. She's actually still alive and still makes appearances.
Really?
But
you're saying your internal organs, that's not normal.
It's not normal. They get pushed up, and they get pushed up against the diaphragm. So this woman probably has real problems breathing, and the ribs actually are the things that help you breathe. Not just your diaphragm, but the ribs expand. And so when you remove half the ribs down there, you totally alter your physiology of breathing.
Aren't you taking away their protection at some degree?
But those ribs protect the liver and the spleen, which are easily damaged, especially in a car accident and stuff like that.
They're there for a reason, the ribs are.
Yeah, they are.
But she's saying it's possible, and it can be done. Obviously, she had it done.
It can be done. It can be done, leaving the ribs there with greater safety, with just gradually tighter corsets, and there's all kinds of websites that talk about it. I was just going to say that it is a desirable thing, and it's something that it's much safer probably to have it achieved through a tummy tuck. I was going to say, and that's one of the main things we do in a tummy tuck, is that when we tighten the muscle, the waist is created in this area above the pelvis, below the ribs. It's actually only this long.
Yeah, here's some photos here.
Yeah, here's an example of somebody we gave a waist to. Yeah, this is a very average-looking abdomen, and so when we did our tummy tuck, we needed to repair the muscle anyway, and we also took away the extra skin. And so we did our main tightening first in the very middle, right above the belly button. The belly button is the lower edge.
So you're tightening the muscle, or you're just removing the fat?
Well, you're removing the fat. See, this is a case where we made a waist by tightening the muscle, focusing really on that area above the belly button. It's not very long. It's about 6 inches long.
That's it?
That's all the average person has to really, where there's no bony support for the waist. And so that's where you tighten the muscle. So
and a lot of times this is a result of pregnancy, right? All that gets stretched out.
Pregnancy just destroys the tummy totally. And so there's so many people that I see, they say, oh my gosh, I feel so guilty that I have this tummy. I've worked so hard and I just can't make it better. And I tell them, no, it's not your fault. You had 3 kids, or if you had twins, that's even more, or big babies. That stretched out your abdominal wall, and there's no amount of sit-ups that can fix it.
Now, I do have a question for you. You said that you tighten the muscle up.
Yes.
Okay, and then you remove the excess skin and some other things.
Yes, sir.
What do you do when you're tightening the muscle? Do you remove actual muscle and then draw it together, or what do you do?
Actually, no. Actually, all muscle has a fibrous lining around it. We take that fibrous lining and sew it together, and we sew it until we get it as tight as we can.
So you just draw it together.
Just draw it together. That's all you do, because it's gapped apart from the pregnancy.
It got stretched like this, and then you're just pulling it back together again.
A lot of times I'll even see someone who's athletic, we got a belly sticking out, they have a six-pack, but it's here. And we sew it together to get the six-pack here. And then there's that loose skin, and then the skin is gone, all that excess skin, and you can actually see the six-pack after the swelling goes down. which is very sweet.
That's amazing.
And that's a little bit safer than taking out half your ribs.
Yeah, I would say so. That's a crazy. It's going to be a procedure that's going to be expensive and look freakish.
We were even talking in the break that there could have been some massive complications from that surgery. She's saying those ribs aren't necessary. We don't agree with that. But you're also saying that there could have been some massive complications.
It's very easy to puncture the lung when you're taking ribs out. Oh, yes, it's very easy. So,
that looks Photoshopped,
now
but it's not.
She's trying to be Jessica Rabbit.
That's what she's.
Who Framed Roger Rabbit? Because you have people that are trying to be like Barbie or things like that, and it's already been proven that those dimensions are not feasible of the human body.
No, they don't exist in nature, and it's hard to get them with plastic surgery. This woman went through hundreds of thousands of dollars of plastic surgery to get where she was.
I imagine she had to go through a few doctors to find someone that would be willing to do that as well.
Oh, absolutely, yeah. She would have come to me, I would have turned her away. I would say yes.
Right.
I would.
And I would think maybe digestive problems eventually, acid reflux. I mean, all that stuff's getting constricted and pushed up and.
Well, some women will do anything to be attractive. Some men will too. They'll do anything. The actual perfect ratio of the waist to the hips is actually 1.6 to 1. And that has been studied since actually classical times. Since the ancient Greeks, they knew that if you see it and this would be 1 to 1.6, it would be the most beautiful. And that is true. We see this in practice.
That's the ratio.
That's the ideal ratio. That's called the golden mean, actually. And anything that's built, actually, those proportions were used in the design of The Last Supper by Leonardo da Vinci. A lot of corporate logos are designed that way. And your credit card actually has those dimensions. So there you go.
I think mine is about 2 to 1.6.
Especially after this Christmas.
Obviously, if you have any questions about having this done safely.
But I can get you away safely. Yes, I can.
And try to achieve that 1.6 to 1 ratio that we just talked about.
That's naturally beautiful, yes.
There you go. Just go visit Dr. Cherny. He is a great guy. HeartlandTS.com.
Well, great holidays to you guys if I don't see you before.
All right, well, hopefully we will. Good to see you.
Always a delight.
Thank you, sir.
Doctor.
Thank you.